आइए हम सुने विज्ञान की अनकही कहानियाँ। आइए हम सुने विज्ञान की अनसुनी कहानियाँ। एक नई दुनिया की आवाज़ आपकी आवाज़, विज्ञान की आवाज़, की आवाज़।
Celebrating Azadi Ka Amrit Mahotsav, we bring you a podcast series on STEM popularization, science, technology, engineering, mathematics and medicine, supported and catalyzed by the National Council for Science and Technology Communication, Government of India. This program is produced by Media for Community Foundation. Creative content and technical support is given by Purvasha Banerjee and Shushanto Das.
एक नई दुनिया की आवाज़ आपकी आवाज़, विज्ञान की आवाज़, की आवाज़, की आवाज़।
Vigyan Ki Awaaz podcast series aims to popularize new ideas of science and technology, which highlight STEM, science, technology, engineering, mathematics, and medicine. This brings to the surface the efforts and researches of Indian scientists, which is desired to bring a change in community learning and teaching, access to knowledge of resources, and social paradigms. Our goal is to spread the name of indigenous Indian research stories and their masters among the masses of society in a very easy manner. Bose Institute was set up in 1917 by Sir Jagadish Chandra Bose, the founder of modern science in the Indian subcontinent. It is Asia's first modern research center devoted to interdisciplinary research and bears a century-old tradition. The institute was founded as not merely a laboratory but a temple, with its principal aims being the advancement of science and diffusion of knowledge. Swami Vivekananda, Sister Nivedita, whose influence is reflected in the institute's emblem of Vajra, was significant in the setting up of the institute, and Rabindranath Tagore were among those who had consistently inspired and supported Jagadish Chandra Bose in his endeavors. Ever since the establishment of the Department of Science and Technology, Government of India in May 1971, Bose Institute has been an autonomous grant-in-aid institution of DST. Over the last century, the institute has endlessly strived to preserve the legacy of its illustrious founder. We welcome Dr. Zhumur Ghosh, Associate Professor in the Department of Biological Sciences at Bose Institute. Dr. Ghosh introduces us to her journey in the field of sciences.
Myself, Dr. Zhumur Ghosh. Currently, I am Associate Professor of the Department of Biological Science, Bose Institute. So, I did my Master's in Physics from Calcutta University, and then did my PhD from Indian Association for the Cultivation of Science, Kolkata, and that in the area of bioinformatics. So thereafter, I went to do my postdoc at Stanford University School of Medicine, California. And then for a very short period of time, I joined at IIT Guwahati. But after that, I directly joined Bose Institute in the year 2010. So today, I shall be talking about basically the power of data science, which we nowadays listen a lot about, and how basically we are using data as well as artificial intelligence to harness the essence of that data and use it for human health.
Professor Ghosh explains her work in detail to help all of us understand the intricacies of research easily.
Basically, for the disease system, we are interested to look into mainly cancer system, and that too the female cancers which are very much prevalent in our country. That is mainly ovarian cancer, cervical cancer and breast cancer. So here basically we know that the human genome is same, but there lies certain flipping of the nucleotide. I must say that there are certain mutations in common man's language which actually creates a proneness or disease risk. So that makes us very different from each other. And that also dictates how the medication will be for a particular type of disease for each individual. So with that perspective in our mind, we looked into that portion of the genome. Again, I'm stressing here that portion of the genome which do not produce protein. Mainly people are interested with those portions which produce protein, because protein actually do the main work. But here we are looking at those portions of the genome which do not produce protein, the mutations within those portions of the genome, because they act as regulators of protein production. So with this thing in our mind, we actually developed online resource, which is called Clinical SNP. Clinical SNP. SNP means single nucleotide polymorphism. That means there is a mutation at a single nucleotide level. So here basically these are clinical SNPs because these mutations actually creates the proneness of a particular individual towards a particular disease. Here, as I've told, that we are interested to look into these 3 types of cancers. So basically we have screened all the patient data, cancer patient data, and we have come up with a set of these sorts of mutations which makes them prone towards this disease. So here we are actually providing those set of mutations which will be very much useful for the general scientific community also who are working with these sorts of mutations, as well as to treat the patients who are actually undergoing or having these sorts of diseases, and this is going to help for decide the medications which they are going to receive. So basically, if I look at a futuristic point of view, if these can be made as a panel, so that when a cancer patient comes, if you test that what sort of mutations are there among these particular sets, then that sort of medication can be provided to them. This is number one. And the second is, if any patient, if any normal person, not a patient, the risk for that particular individual for these types of cancers, that also can be predicted.
Professor Ghosh enlightens us about the application and implication of her work.
So basically, as I have told, that we have this online resource which is already there. So this can be accessed by the similar scientific community, as well as it can be used by the clinicians currently. This has also been published in a reputed journal, RNA Biology. So it also has got a lot of citations within these years because this has been published just a few years back. So we are also, upgrading this thing because we are validating some portions of the data sets so that we can come up with a stringent set of panel which can directly be taken to the clinicians. This particular work is what we are doing in our lab, but rather a different aspect. As I told you that within the genome, we had 2 portions. The other portion which codes for protein, people are also interested to look for the mutations at those positions also. So in ACTREC Mumbai, there are scientists who are working with the Indian individuals, Indian cancer patients specifically, where they are having these sorts of mutations. So they are working with those regions which are basically producing protein. But what we are doing here is we are looking into the regulatory aspect upstream. So basically those portions of the genome which do not code for protein but controls protein production.
Madam also highlights how her research can contribute to the lives of people in India.
How is it going to actually be implemented, or rather how it will be directly useful to people of our country? So here basically we are moving towards personalized healthcare system. And in India, using this is to some extent to its infancy. But the main important thing is, as you know, this particular thing will need certain infrastructure for accessing as well as analyzing multi-omic data sets for analyzing these sorts of mutations within the patients, and that too at a very low cost, so that it can reach common people. So that infrastructure needs to be built up in India so that we can really take it as a personalized, integrate it within the personalized healthcare system, which can be implemented in India. So India basically is at its infancy right now. In US or abroad, they have already started working on these things, because this is very important. Screening your profile and my profile, I mean, it's very different. So this is very, very important. And actually, this is the buzzword of the next era. So in India, still now, the clinical data, I mean, these genomic or multi-omic data sets are not that much available. And that is why we have mined the data sets which is available throughout the world. So that we have taken. But definitely it will be very good if we can resume this whole thing or do the whole work on exactly on the Indian data set. But that is not available right now, but it will be useful for Indian scenario also.
Professor also mentions about the way forward from this current body of research.
So the way forward is basically, as I've told you, that we need to have that basic infrastructure so that we can acquire these sorts of data from the patient who are coming. And then we need to have that, again, the infrastructure to analyze them and provide them with the final outputs, and also at a considerable cost. I mean, cost shouldn't be much more. That is very important.
We thank Professor Ghosh for such a detailed discussion on her area of research.